This is Leslie Firth. I'm going to talk to you guys about the Lilly KwikPen today. It comes in 3 different types of insulin. You can get Insulin Lispro, which comes in a purple pen, an Insulin Lispro Protamine and Lispro Mix, which is 75/25, and that comes in a yellow pen. You can also get the Protamine and Lispro Mix in a 50/50, and that's a red pen. So the Insulin Lispro is a rapid-acting insulin. The duration is less than 5 hours. Onset is 15 to 30 minutes. The 75/25 mix with Protamine and Lispro is a mix. The Protamine is an intermediate-acting insulin, and the Lispro is rapid again. The duration is 14 to 24 hours. And the 50/50 mix, again, is the duration is 14 to 25 hours. And it also has Protamine suspension and Lispro. The frequency of administration, the Lispro, which is rapid acting, should be injected 15 minutes before a meal or immediately afterwards. And the mixes would be usually a twice-a-day dosing, 15 minutes before eating, so like before breakfast or before dinner. The extra supplies you need, needles. It's compatible with BD ultrafine needles, and alcohol swabs, and then something to sanitize your hands. Each pen, you can dose a minimum of 1 unit to a maximum of 60 units. Warnings and precautions for insulin, again, would be hypoglycemia. For the pens, injection site reactions and allergic reactions. If a rash develops or you have trouble breathing, you should contact emergency help immediately. So storage for the pens, you keep them in the refrigerator at the pharmacy. Do not freeze them. Once they're dispensed to the patient, they can keep them at room temperature. This should keep them away from light and leave the cap on when not in use. So for the Lispro pen, you should discard it after 28 days, even if there's still medication left in the pen. For the 75/25 mix, you discard it after 10 days, even if there's still insulin left in the pen. And for the 50/50 mix, also discard it after 10 days. So to start off, you're gonna wash your hands, sanitize your hands somehow. You're gonna check the pen. Important to tell your patients, make sure they're checking it's the right type of insulin, especially if maybe they have multiple pens. That's why the companies have come up with different colors to try and make it easy for them. So you're gonna take the cap off. Take an alcohol swab to select your site, which is subcutaneous. Most patients like to do it in their abdomen, about 1 inch away from their navel. Make sure you know that they need to rotate sites, and also swab the top of your pen if it's been used before. If it's a mix, as Ryan said in his Flex Pen demonstration, you want to make sure that you roll it so to mix the insulin. So you're going to roll it back and forth 10 times, as well as invert it 10 times, just to make sure that everything's evenly cloudy, there's no precipitate in there. So then you're going to pull the tab off of your needle, stick it straight onto the pen, and twist to attach it firmly. Take this outer guard off and save that for later. And to prime the pen, you're going to go, which you do every time you use the pen, you put 2 units on the dial, take the inner guard off, you can discard that. And you want to prime the needle into the air, just to make sure that insulin is actually coming out of the top of the needle, and you should depress this dial so that it goes back down to 0. So then it's primed, there's insulin coming out of the top of the needle. If not, you just want to repeat that until you do see insulin coming out. Then you'll select whatever your dose happens to be. You've already selected your site. You're going to stick the needle in, depress the dose knob, hold the needle in and count to 5, and then pull the needle straight out of your skin. Carefully replace the outer guard. You can use the swoop method if you want, and go ahead and twist that off, and the needle should come with it. This will go in a sharps container. And then you can just recap your pen and keep it in a safe place where it won't get damaged. People like these pens. They're pre-filled, especially with the mixes. Mixing insulin yourself can be definitely a hassle. You need a lot of materials. It's hard for patients to do. These come pre-mixed, so a lot of people think they're worth the extra cost. They don't need to be refrigerated, and they're easy to bring along with you if you're going to be out.